in the case of diesel, 24 cents per gallon. My friends, the price of a gallon of gas continues up. Why don't we give American working men and women a little break for the summer? Just a little break for the summer. I mean, it's not the end of Western civilization as we know it. We may not be able to fund the $233 million bridge in Alaska to an island with 50 people on it. We may not be able to send $10 million to a county in Florida that said they didn't even want it. And we may not fund a whole bunch of the pork barrel, unnecessary, wasteful projects, absolutely wasteful projects that are put in the middle of the night in these spending bills that have nothing to do with need or priority, but everything to do with the corrupting process that makes it dependent on the influence and power of an individual member of Congress or senator. And I say corrupting process because former members of Congress are now residing in federal prison. I'm going to stop that practice. I'm going to stop that pork barrel earmarking wasteful spending practice, and I will veto every single pork barrel bill that comes across my desk. Meanwhile, Senator Obama and Senator Clinton have gotten hundreds of millions of dollars in pork barrel earmark projects, one of them being the Woodstock Cultural Museum, in case you missed that one. $1 million of your tax dollars. Senator Obama got a whole bunch of money for the Seed Museum. You know, with the Americans and the problem that they're in today, do we need to spend millions of dollars on a seed museum? I don't think so. So, they want business as usual in Washington. They want the pork barrel. Senator Obama wants the pork barrel earmark projects to go on. And I want to give the American consumer a little bit of relief just for the summer. Maybe they'll be able to buy an additional textbook for their children when they go back to school this fall. And you know who spends the most proportionate money? You know the regressiveness of the gasoline tax? It's on the poorest Americans. They drive the furthest, and they drive the older automobiles, which are the highest gas guzzlers that consume the most gasoline. So let's give low-income Americans a break this summer and realize that maybe they deserve it, given the increase in food costs, given the increase in cost of gasoline, given the increased expenses that they are facing, particularly when most of them are on fixed income, or, even worse, having lost their job. So I had to get that issue out of the way, and I'm astonished at the influence of the special interests who are saying what a devastating impact this would have. Take the money out of general revenues, cancel some of the pork barrel projects, the billions of dollars worth, and go ahead and replace that gas tax money that we are giving lower income and working families a relief from. Now I need to talk to you, obviously, about health care for a few minutes, and then we will talk more. And I want not only to hear your views and your questions, but I would be glad to have you keep the microphone so that on the rarest of occasions, when I don't completely answer your question or comment, you can come back. That's what the dialogue is supposed to be about. First of all, I don't usually begin my comments about health care in America on this note, but here we are in this center, which has the greatest facilities for wellness and fitness. And this city and this state is well known for wellness and fitness. It's practiced enormously. And the facilities here that people, as Larry mentioned, anyone can come here and use these facilities to exercise, to work out, to have the opportunity to improve their health and fitness. That's really one of the fundamental problems and challenges that America is facing today. One of the most alarming statistics recently is the rise amongst young Americans of obesity, diabetes, and high blood pressure. My friends, no healthcare system in the world can be sustained if our next generation is not healthy. And that's an enormous challenge for America. Wellness and fitness. We should have insurance companies pay cash bonuses back, and employers pay money back to employees who are well and fit. We need to encourage membership in health clubs and attendance at facilities like these. We need to have every American parent find out what the school lunch program is in their school. We need to have every American parent and school board look at the physical education regime at our schools. We need very badly to have young Americans inspired and learn about the evils of smoking. My friends, smoking is going to is one of the greatest killers there is, and it's a voluntary act. I'm embarrassed when I see the taxes on a pack of cigarettes go into general revenues rather than go to anti-tobacco programs and treatment of tobacco-related illnesses. That was what it was intended to do when we put taxes on a pack of cigarettes, and they're not doing it. Not this legislature, not the Arizona legislature, not other legislatures. My friends, we can teach young people about the evils of smoking. Let me just mention to you one brief anecdote, because sometimes it's good to have a real-life example. I was in Miami, Florida, at Miami Children's Hospital. It's an incredible facility. I saw where a tiny infant had a heart operation, and that infant's life was saved. It was remarkable. A young boy who had been hit by a car was healed. But I also met a young man who had, over a very relatively brief period of time, had lost 76 pounds. He lost 76 pounds, and the motivation for him to do so was a thing called Shaq's Challenge. Shaquille O'Neal, now with the Phoenix Suns, by the way, then with the Miami Heat, had inaugurated a program called Shaq's Challenge, where he challenged young students to get well, to exercise, to diet correctly. This young man had lost 76 pounds. My point is, Americans, young people, look up to and respect our stellar athletes and our great athletes. I wish they looked up and respected us as much, but we know what the reality is. We know what the reality is. And the reality is that they respect and admire these people. And these athletes are great Americans. And I'd like to see a program that's obviously voluntary, where these great athletes would go around to our schools and talk to young students and tell them the importance of being well and fit, and inaugurate a program such as Shaq's Challenge. Because I'm sure that young man, he may have been motivated to lose that 76 pounds, but we know it's obvious what the direct connection was. So wellness and fitness is obviously a vital element if we are going to take care of the healthcare costs in America. Now let me just start out with one fundamental premise with you. It is not the quality of healthcare in America that's the problem. The quality of healthcare in America is the highest of any place in the world. That's why when wealthy people all over the world become ill, they come to the United States of America for treatment. So it's not the quality of care, it's the cost and availability of care. And the inflation associated with healthcare has been at double-digit or near that, and we cannot stand that. No system can stand double-digit inflation associated with healthcare. So we've got to bring costs down and make it available. That's America's challenge. America's challenge is not the quality of care. No one in this room has known our doctors and physicians, and the state of technology in America today would hardly disagree with that. But we have the problem of cost. Now, there's a broad array of approaches that need to be taken, but fundamentally, I believe that if you adopt the program and proposals of Senator Clinton or Senator Obama, you will have a wasteful, inefficient, costly system replaced by a more inefficient, wasteful, costly system, because that's what's happened in countries where they have adopted universal health care. When government runs health care, it'll be far more inefficient and wasteful. And by the way, the next time you think you want to have government run any health care system or others, head on out to the airport here that I just landed at and go through security. If you think we know how to have efficient systems and well-run security in this nation. But anyway, that's a cheap shot. But anyway, let me just say, then we have to address these issues one by one. And I'll say there's many. Community health centers obviously are important for low-income people. Walk-in clinics. The most expensive form of health care in America, as we all know, is emergency room care. If Walmart or one of these people wants to have a clinic where they have a doctor or pharmacist and you've got a routine health need and go in there and get quick treatment and the pharmaceutical drug that you need, fine, let's do it.